Very good evening. Welcome to News Tonight on Rajya Sabha television, where you get a complete roundup of the day's top stories from India and across the world. I'm Aishwarya Kapoor with you. So let us start with the day's big story. The biggest story of the day. The Union Home Ministry on Friday extended the nationwide lockdown for 2 more weeks beyond 4th of May 2020.
The ministry also issued new guidelines to regulate different activities during this period. This will be based on the risk profiling of various districts into red, orange and green zones. But even under these new guidelines and irrespective of the zones, a few activities are prohibited throughout the country. These are travel by air, rail, metro and interstate movement by road, running of schools, colleges and other educational and training coaching institutions, hospitality services including hotels and restaurants, places of large public gatherings such as cinema halls, malls, gymnasiums, sports complexes, etc., social, political, cultural and other kinds of gatherings and religious places and places of worship for public. However, movement of persons by air, rail and road is allowed for select purposes as permitted by the MHA. The new guidelines also prescribe measures for the well-being and safety of persons. Accordingly, movement of individuals for all non-essential activities is strictly prohibited between 7 p.m. to 7 a.m. Local authorities will issue orders under appropriate provisions of the law, like prohibitory orders under Section 144 of the CRPC for this purpose. In all zones, persons above 65 years of age, persons with comorbidities, pregnant women and children below 10 years shall stay at home except for meeting essential requirements and for health purposes. Outpatient departments and medical clinics shall be permitted to operate in red, orange and green zones with social distancing norms and other safety precautions. However, these will not be permitted within the containment zones.
And the government on Friday said that there is no shortage of medical equipment to tackle COVID-19. In what appears to be a huge boost to the Make in India initiative, P. Waghela, chairman of the Empowered Group 3, informed the media that India is in a position to domestically produce more than half of the ventilators and PPEs that are needed. Take a look at this report.
With a projected need for 75,000 ventilators to fight the coronavirus pandemic over the months of April, May and June, the centre already has 19,000 in stock. The government has ordered over 60,000 ventilator units, out of which only 1,000 will be imported, and orders for 59,884 have been given to local manufacturers.
We have identified 7 manufacturers in the country. जो मैं बराबर अभी मैं बताता हूं आपको कि बेल जो हमारी भारत इलेक्ट्रिकल लिमिटेड हैं और स्कैनरेकर की एक कंपनी है, ये दोनों को मिलकर 30,000 का ऑर्डर दिया है. मारुति सुजुकी एंड आगवा करके है, आगवा एक न्यू स्टार्टअप है, उसको 10,000 का ऑर्डर दिया है. एंड आंध्र प्रदेश मेडटेक जोन है, बहुत बड़ा PSU है स्टेट गवर्नमेंट का और भारत सरकार की सहायता से बनाया गया है, उसका 13,500 का हमने ऑर्डर दिया है. उनको डिपार्टमेंट ऑफ बायोटेक्नोलॉजी ने भी वर्ल्ड बैंक थ्रू उनको लोन और सहायता दिया हुआ है.
Against the projected demand of 2 crore PPEs, the government has ordered more than 2.2 crore, out of which 1.42 crore units will be manufactured domestically. From no domestic manufacturers earlier, India now has 111 indigenous manufacturers of these products.
2 करोड़ का हमारा रिक्वायरमेंट दिया है, मोटा मोटा हमने ऑलरेडी ऑर्डर कर दिया है 2 करोड़ 22 लाख का. डोमेस्टिक ऑर्डर्स हमने दिया है 1.42 करोड़ का. और मुझे बताने हर्ष होता है कि डोमेस्टिक प्रोडक्शन जो कुछ भी नहीं था वो आज कल की तारीख की मैं बता रहा हूँ 1,87,000 रोज बन रहे हैं, आ रहे हैं और राज्यों को दे रहे हैं. ये सबसे बड़ी बात है. तो अच्छा, अरे हमारा जो ये मेक इन इंडिया का जो हमारा जो कॉन्सेप्ट था ये हम यहाँ भी लाए हैं.
The same is the case with N95 and N99 masks. While projected demand for them is 2.7 crore units, the government has ordered 2.49 crore, of which 1.5 crore will be manufactured by domestic manufacturers.
कि डीआरडीओ ने नया मास्क का मटेरियल नया डेवलप किया और वो N99 मास्क है। हमारा डिमांड हमको दिया है 2.72 करोड़। हम अच्छा, इसमें से टोटल हमने ऑर्डर कर दिया है 2.49 करोड़ का किया है। अच्छा, डोमेस्टिक ऑर्डर है 1.49 है और उसका भी कैपेसिटी बताइए, जीरो था। आज का जो मैं कल का फिगर दे रहा हूँ वो रोज का 2,30,000 बनना शुरू हुआ है और ये बहुत बढ़ने की संभावना है क्योंकि नए नए मैन्युफैक्चरर्स भारत के ही आ रहे हैं।
Waghela disclosed that India has sufficient supply of oxygen cylinders as well.
जो ऑक्सीजन सिलेंडर की जो मैं बात करना चाहता हूं तो 4,38,000 मेडिकल ऑक्सीजन सिलेंडर्स अवेलेबल है जो आज की जरूरियात के लिए पर्याप्त है। हमने 1,03,000 नया सिलेंडर परचेज किया है। पहली बार भारत सरकार मिनिस्ट्री ऑफ हेल्थ पहली बार परचेज कर रही है और परचेज करके हम इसको सप्लाई चेन में डालेंगे। तो 1,03,000 का ऑर्डर दिया है और सब भारत के मैन्युफैक्चरर्स हैं।
These numbers are significant in light of the rising number of COVID-19 cases in the country, which rose to 35,365 on Friday, with an increase of 1,755 cases and 77 deaths in the last 24 hours. So far, a total of 9,064 people have been cured, bringing the recovery rate to 25.37%. A total of 1,152 people have died across the country so far. Bureau Report, Rajya Sabha TV.
As migrant crisis looms large with lakhs of workers stranded across the country due to the nationwide lockdown, there has been some positive movement on Friday. The Indian Railways operated its first special train for the interstate movement of migrants.
In the first such move, the railways operated a special train from Telangana to Jharkhand, taking about 1,200 migrant workers home. The railways said all necessary precautions, including prior screening of passengers, maintaining social distancing at stations and in the train, were followed. It also said that the 24-coach train carrying migrants from Telangana to Jharkhand is a pilot project and a decision on more such special trains will be taken later. Many states including Chhattisgarh, Bihar, Punjab, Rajasthan and Kerala have reportedly urged the centre to run special trains for migrant labourers who are stranded in other states. Meanwhile, the Uttar Pradesh government is estimated to bring back nearly 1 million workers and has deployed buses from states like Madhya Pradesh and Gujarat. The state government has already brought back around 13,000 people from Haryana. The Karnataka government has already assigned state nodal officers to coordinate with 11 different states to facilitate the movement of migrant workers. Rajasthan Chief Minister Ashok Gehlot and Kerala Chief Minister Pinarayi Vijayan have both urged the centre to allow Indian Railways to operate trains for hassle-free transport of migrant workers to their home states. Maharashtra Chief Minister Uddhav Thackeray has said intra-state transport will be started and district collectors will decide the priority. The Jammu and Kashmir administration on Friday brought back its 3,000 labourers stranded in other parts of the country. The Delhi government has also sent 40 buses to bring back students from Delhi who are stranded in Kota. Delhi government has also sought the details from other states about the number of their migrant workers stranded in the national capital. The centre had last week issued fresh guidelines for interstate movement of migrant workers.
उन लोगों की आवाजाही की अनुमति रेल द्वारा भी दी है जो लॉकडाउन की वजह से फंसे हुए हैं, जैसे स्टूडेंट्स, माइग्रेंट लेबर, टूरिस्ट और पिलग्रिम्स। इसके लिए संबंधित राज्य सरकारें एवं रेलवे बोर्ड उचित व्यवस्था करेंगे और सभी हेल्थ प्रोटोकॉल्स का अनुपालन सुनिश्चित करेंगे।
आज दिल्ली से लगभग 40 बसें कोटा जा रही हैं और मुझे उम्मीद है कि शायद कल ये बसें उन बच्चों को लेकर वापस आ जाएंगी। अन्य सरकारों के साथ भी बातचीत के जो नतीजे निकलेंगे हम आपको ज़रूर बताएंगे। जो भी फाइनल प्लानिंग होगी हम आपको ज़रूर बताएंगे। तब तक अपने अपने घर में रहिएगा, घर से बाहर मत निकलिएगा, लॉकडाउन का पालन करिएगा ताकि हम कोरोना को हरा सकें।
And the Union Health Ministry on Friday updated the list of COVID-19 zones for the week after 3rd of May when the second phase of the nationwide lockdown ends.
As per the new list, the government has declared 130 districts as red zones,
284 as orange areas and 319 green zones. Maharashtra, Delhi and Gujarat are among the badly affected COVID-19 states according to the list. The Health Ministry has designated as red zones all major metropolises including Mumbai, Chennai, Kolkata, Hyderabad, Bengaluru and Ahmedabad.
टोटल इंसिडेंस ऑफ केसेस वहां पर कितनी है, उसके साथ ही वहां पर डबलिंग रेट कैसा है केसेस का, साथ ही वहां पर टेस्टिंग किस लेवल पर हो रही है, वहां पर हमारी सेंट्रल आरआरटीज जो गई हैं, होम मिनिस्ट्री की आरआरटीज जो गई हैं जिसमें कि हमारे हेल्थ के प्रोफेशनल्स हैं उनका फीडबैक क्या है, जो हमारा रेगुलर सर्विलेंस स्टेट के साथ कोऑर्डिनेशन में चलता है उसका क्या फीडबैक है, इसके साथ ही वहां पर डेंसिटी ऑफ पॉपुलेशन कैसी है कि क्या वह एरिया आज अगर वहां पर थोड़े से कम केसेस है बट दिस इज ए क्रिटिकल एरिया कि कल को वहां पर प्रॉब्लम ऐसी ना हो जाए कि अंडर करंट के रूप में वहां पर केसेस इतने हो कि वह जिला उसे मैनेज ना कर सके. नाउ किसी भी एक पर्टिकुलर जिले में अगर वहां पर इससे पहले वह रेड या ऑरेंज है तो साथ में अगर वहां पर कंटेनमेंट एफर्ट्स अच्छे ढंग से चल रहे हैं जिसका इम्पैक्ट आना शुरू हो गया है तो हमने कहा है कि 21 दिन अगर उस जिले में कोई केस नहीं आता तो आप उसको रेड या ऑरेंज से निकालकर आप उसको ग्रीन जोन में कंसिडर कर सकते हैं.
In the national capital, all 11 districts of Delhi fall under the red zone. Addressing the media on Friday, Delhi Chief Minister Arvind Kejriwal said one of the reasons for the steep hike in Delhi's coronavirus cases is due to an increase in testing. He also stressed that the state will continue clinical trials of plasma therapy as initial results prove to be good. Kejriwal also urged the people of Delhi to stay calm and continue to follow lockdown guidelines. Meanwhile, the Haryana government has sealed the Delhi-Gurugram border to restrict the entry of people from outside the district. The state government is only allowing essential services and goods as well as some government officials to cross the Delhi-Gurugram border.
हम दिल्ली में खूब टेस्ट करा रहे हैं, जम के टेस्ट करा रहे हैं. आज दिल्ली के अंदर हर 10 लाख की पॉपुलेशन पे लगभग 2300 टेस्ट हो रहे हैं. अंग्रेजी में कहते हैं पर मिलियन पॉपुलेशन पे 2300 टेस्ट हो रहे हैं, जबकि पूरे देश का एवरेज जो आंकड़ा है वो है लगभग 500 के करीब का. तो पूरे देश में 500 के करीब टेस्ट हो रहे हैं जिसके अगेंस्ट में 2300 टेस्ट दिल्ली के अंदर हो रहे हैं. इस वजह से दिल्ली में केसेस की संख्या ऐसे लगता है जैसे काफी बढ़ती जा रही है.
Meanwhile, Maharashtra Chief Minister Uddhav Thackeray has asserted that the state seems to be succeeding in breaking the chain of the coronavirus infection. He said some restrictions would be lifted after the 3rd of May, depending on the zones decided by the spread of the cases, but there will be no restriction on agricultural activities. Thackeray also said that the state is taking assistance from the Ayush Ministry to treat COVID-19 cases in Maharashtra. The Bihar Health Department is conducting door-to-door COVID-19 screening in affected districts to identify cases. In Karnataka, capital city Bengaluru's civic body has made wearing masks that cover mouth and nose mandatory at all public spaces and workspaces that have more than 5 people. In Goa, the state government has decided that people not wearing masks will not be given fuel at petrol pumps or ration at fair price shops in the state. Meanwhile, the total number of coronavirus patients in the country has climbed to 35,043. With 10,498 COVID-19 cases, Maharashtra continues to have the highest number of positive cases, followed by Gujarat at 4,395 and Delhi at 3,515. Among the other most affected states are Madhya Pradesh with 2,660 cases, Rajasthan with 2,584 cases, Uttar Pradesh 2,203 and Tamil Nadu 2,323 COVID cases.
And on to some other news. The elections for the 9 vacant seats in the Maharashtra Legislative Council would be held on 21st of May. The Election Commission announced this after a meeting on Friday.
The election will be notified on 4th May. 11th May is the last day to submit nominations and candidates can withdraw them by the 14th of May. Polling and counting of votes will take place on the 21st of May. The decision by the poll panel gives Maharashtra Chief Minister Uddhav Thackeray an opportunity to become a member of the state legislature within the 6-month deadline that ends on 27th of May.
The election panel has urged the Union Home Ministry to depute an officer of suitable seniority to ensure that preventive measures are in place for the smooth conduct of the electoral process in keeping with the provisions of the Disaster Management Act. It has also directed the Maharashtra Chief Secretary to depute an officer to ensure that instructions on COVID-19 are followed while making arrangements for the elections. Further, the Election Commission has appointed Maharashtra Chief Electoral Officer, the observer, for this election.
And the Indian Air Force is playing a vital role in combating the spread of COVID-19 by speedily delivering essential items like medicines, equipments, and rations across the country. Here is a detailed report.
In recent days, the Indian Air Force transported supplies and commodities to Manipur, Nagaland, and Gangtok in the northeast, the Union territories of Jammu and Kashmir and Ladakh. On 25th of April, Indian Air Force's transport aircraft reached Mizoram with 22 tons of medical supplies. Ever since the lockdown began on the 24th of March, the IAF has transported nearly 600 tons of medical equipment and support material to different places. It flew dedicated sorties for DRDO, airlifting around 9,000 kg of raw material to produce personal protective equipment. It also airlifted N95, N99 masks manufactured by DRDO. In addition, the Indian Air Force has also set up several quarantine facilities at its bases across the country. Medical care to Indian citizens evacuated from Iran and Malaysia is being provided at its Hindon and Tambaram bases respectively. A COVID-19 testing laboratory at Command Hospital Air Force, Bengaluru, is also operational for testing. Earlier, a 15-member team of Armed Forces Medical Services Rapid Response was also sent to Kuwait in response to a request from the state of Kuwait.
And now the global update. The United States continues to be the worst affected country due to the COVID-19 pandemic. The country registered more than 2,000 deaths in the last 24 hours, taking the total death toll in that country to more than 62,906. And the United States has more than 1 million people infected with novel coronavirus.
Some European countries, meanwhile, are considering plans to ease lockdown measures as the rates of new infections and deaths slow down. Spain on Thursday registered further fall in the number of deaths and new cases. Over 24,500 people have died from the COVID-19 infection in Spain so far, and over 2.1 lakh people have the disease. 1,12,050 patients have recovered in the country. Italy on Thursday recorded the highest daily number of coronavirus recoveries since the crisis began in late February. 4,693 patients recovered on Thursday, bringing the total nationwide recoveries to 75,945. The death toll on Thursday was 285, taking the total to 27,967. Italy entered into a national lockdown on March 10th to contain the pandemic. Beginning May 4th, the manufacturing, construction and wholesale sectors will be allowed to resume work in view of the slowing rate of infection and deaths in the country. Germany has also agreed to cautiously ease the COVID-19 restrictions. Playgrounds, museums, galleries, zoological gardens and places of worship are accessible again, but social distancing rules will remain in force. Germany has over 1,55,000 confirmed cases and at least 6,288 people have died due to the virus. France on Thursday reported 289 COVID-19 deaths, taking the tally to 24,376. The total number of people infected with the virus in the country stood at 1,29,580. Meanwhile, Russian Prime Minister Mikhail Mishustin has tested positive for COVID-19. A total of 1,06,498 confirmed cases have been reported in the country so far. On Thursday, the total number of confirmed cases of COVID-19 worldwide rose to 3.3 million, while the number of fatalities crossed 2.3 lakhs globally.
And Maharashtra and Gujarat had their 60th Foundation Day on Friday. Both the states were formed with the enactment of the Bombay Reorganization Act on 1st of May 1960. Many leaders, including the President, the Vice President and the Prime Minister, extended their best wishes to the citizens of the two states. In a Twitter message in Marathi, President Ramnath Kovind expressed hope that the state will continue to prosper and remain safe. In a similar message in Gujarati, the President greeted people of Gujarat on their state's foundation day. He wished the state uninterrupted progress and prosperity for years to come. Vice President M. Venkaiah Naidu called Gujarat the birthplace of great leaders like Mahatma Gandhi and Sardar Patel, who shaped the nation's destiny. He praised the people of the state for their spirit of entrepreneurship and innovation. Greeting the people of Maharashtra on their foundation day, Vice President Naidu said the state had played an important role in national development. In a Twitter message in Gujarati, Prime Minister Modi said the people of Gujarat have made special contributions in many fields and Gujarat has touched new peaks of achievements. Extending his wishes to the people of Maharashtra in a Twitter message in Marathi, Prime Minister Modi said, India is proud of Maharashtra's significant contribution to the country's development. And it is the International Labour Day today, also known as the International Workers' Day or May Day. It is celebrated to honour the contribution of the labour force in the development of the global economy. President Ramnath Kovind greeted workers on the occasion of International Labour Day. In a tweet, he said that this day is dedicated to honour the hard work and dedication of crores of men and women workers. President Kovind also said that workers are laying the foundation of a better and prosperous India and are nation builders in the true sense. Union Ministers Rajnath Singh and Amit Shah also extended their wishes on International Labour Day and said that the centre is committed towards labour welfare. Labour Day or Shramik Divas is celebrated for labour rights and unity. The day came to be celebrated due to the 8-hour workday movement that began in the United States towards the end of the 19th century. On 1st of May 1886, the labour class of America took to the streets against their work regime of 15 hours a day. While the protest was on, the cops opened fire, killing several labourers and injuring over 100 people. The International Socialist Conference decided to celebrate Labour Day on 1st of May every year following this incident. In India, Labour Day was first celebrated in Madras on 1st of May 1923. And that is the wrap on this edition of News Tonight. Thanks for watching. Good night and take care.